Hello, and welcome to your introduction into medication reconciliation, also known as Med-Rec. First, we will review doing an admission Med-Rec. To do an admission, navigate to your Orders tab. You can see a patient's reconciliation in the upper right-hand corner. You can see that admission has not been done, nor has a discharge, but the med history has already been completed. To get to admission Med-Rec, you come to the reconciliation drop-down. Select admission. For admission Med-Rec, there are two options. The green is to continue an order. The red stop symbol and column is to stop an order. On admission, all current hospital orders default to continue. That does not mean you have to keep the order. You can change it and say to discontinue it. The only other items to address are the patient's home medications and whether or not they should continue to take the medications while they're here in the hospital. I am going to select continue the patient's home medications. Once you are completed addressing all the orders, down in the bottom right-hand corner is your option to reconcile and sign. That is how you completed admission Med-Rec. For circumstances when your patient is in the hospital and they're going to transition and move to the inpatient rehab or the inpatient behavioral health unit, for those instances, you will not complete a discharge Med-Rec. You will complete a reconciliation known as a transfer to from rehab/behavioral health. It works the same as an admission. You address whether to continue or stop the medication. You will notice that the home medications that were continued are bundled up with the inpatient order. This maintains the integrity of the patient's home med list. Again, once you have addressed all the orders, your reconcile and transfer button is in the bottom right. You will notice when you do a transfer to from rehab/behavioral health, notice that it counts as a discharge Med-Rec. And now there is a blue question mark above the admission. What that is telling you is that there is now an admission Med-Rec ready and waiting for when the patient transfers to behavioral health. Using this transfer reconciliation, again, accounts for a discharge on the inpatient side, and it also acts as the admission Med-Rec for when the patient actually moves to the rehab or behavioral health unit. Now we are going to review a discharge Med-Rec. Again, you will navigate to the Orders tab. From your reconciliation drop-down, you would select a discharge. Upon discharge, medications are grouped by sections. You will notice a section for continued home meds. Then there will be a section just for medication orders. The continued home meds section is exactly what it says. They are medications that the patient was taking at home, notated by the scroll symbol, and they were also continued while they were in the hospital, noted by the hospital symbol. What is nice, having the two paired right next to each other, is you can easily see if there has been a dose change or a frequency change from the home med to the hospital med. In this case, the patient's levothyroxine, they were on 112 mics at home. During the hospital, that was increased to 137 mics. So at discharge, you have to make the decision, should the patient go back home on their home med dose, or do they need to be prescribed this new dose and stop taking the original? There are two buttons down in the bottom right for physician convenience that are frequently used. Many providers will say to continue their home meds and to stop the hospital meds. That way it completes all the lines. And then they come in and adjust the one or two meds that maybe have to be fixed. In this case, with the levothyroxine, we want to stop this old dose and we want to prescribe the new dose. You will notice the blue circle that is telling me that order details have not been completed. So if I click on it, the orders detail box will show below. And as with everything else in Cerner, yellow is a requirement. It wants to know how many tablets I'm prescribing. And as a resident, you will have to put in a supervising physician's name. Another thing to notice is the type of therapy. While many medications will be maintenance therapy, frequently patients are sent home on short-term medications like antibiotics and/or pain medications. It is important to change the type of therapy to acute. That way, when the patient comes back to the hospital, say 6 months from now, if it was an acute medication that was only meant to stay on the patient's home med list for 7 days, it will no longer appear if you had changed the type of therapy to acute. Please note that we do e-prescribe all medications. You can see the Send To field for this patient is listing a printer. If you do not see a pharmacy's name in here, you can double check with the patient if they have a preferred pharmacy. Otherwise, in order to be able to print, you do have to fill in the e-prescribe exception field and give a reason as to why you are not e-prescribing. Without filling in this box, the prescription will not print for you. When you are done, you would say sign. There is no need to do sign and print, as the patient is going to get a copy of their patient-friendly med list from the nurse at the point of discharge. You will notice that my reconciliation status is now updated to a green check mark for discharge. That is the end of the reconciliation video. If you have any questions about MedRec, please contact Clinical Informatics via Perfect Serve. Thank you.